I'm now going to introduce my co-panelists, our briefers. I'm going to ask each of them, please, to stick to 5 minutes, given the number of people here. So can I first start, please, with Dr. Ahmad Tarakji? Thank you.
Thank you, Your Excellency, for the opportunity. My name is Ahmad Tarakji. I'm the president of the Syrian American Medical Society. Thank you for joining us this afternoon. My organization works to provide medical relief for Syrians throughout Syria, the people who are in need of medical support and humanitarian support. Last year, we provided services to 3.2 million people inside Syria, an additional almost 500,000 people in the neighboring countries. In East Ghouta, we support 16 medical facilities, including the largest hospital in Ghouta, as well as the women's hospital inside Ghouta. We also support about 280 medical workers inside Ghouta. Today, I'm here on their behalf to be their voice. Given the inability of the UN agency to provide urgently needed food supplies to starving civilians of Ghouta, SAMS also partnered with local humanitarian workers inside Ghouta. And over the last month, we were able to provide more than 100,000 meals inside Ghouta. And to give you perspective, this equates about 10% of the entire UN agency operation in Ghouta at that time. This is us alone as an NGO. This is not acceptable. The Council has failed to even remotely implement Resolution 2401, failed to protect humanitarian workers, and failed to protect civilians. We all know that. But hopefully today, we can turn a page and begin constructive dialogue through which to protect aid workers in Syria, throughout Syria, to protect civilians, and provide truly impartial, sustained stability and assistance to the people of Syria. Again, all of Syria. That is what we need to do in accordance with the international humanitarian laws. Protection of humanitarian workers and medical facilities is critical. In less than 1 month, more than 26 hospitals were targeted deliberately inside eastern Ghouta. And to give you an estimate of what happened between February 18 and February 20th, 48 hours, 11 facilities were targeted by airstrikes. That dropped our capacity inside Ghouta by 60% in less than 48 hours. Most of the ambulances were chased by drones and were shot. And yet again, the international community failed to adequately respond. And that's why, in the face of such continuous heinous violations of international law for more than 7 years, we as humanitarian and medical organizations decided to take the following action. SAMS and our partner organizations decided to share the coordinates and the hospital locations in Syria with the UN OCHA. And we're asking international monitoring mechanisms to be implemented to monitor those hospitals and protect them. And today, we are calling on the humanitarian task force in Syria, led by the United States and Russia, to take steps to implement this protection. And we pledge that the international community, the UN Security Council, to take steps to help us, protect us from these continuous airstrikes that did not stop for the last 7 years. And if our doctors are willing to hand over their coordinates, compromise and risk their safety, at least we can meet them halfway and take the necessary steps to protect them. It is our responsibility. The humanitarian workers also deserve protection. These workers are subjected to displacement, detention, killing. That's all because they're serving their own communities. That is not acceptable. And yet, there has not been any serious action to protect these aid workers. Instead, we only see public statements admiring their work and then acknowledging their death. That's what we're suffering from inside Syria. The United Nations and the leaders of the humanitarian task force in Syria must also take tangible public steps to protect humanitarian workers and support their work. The people inside Ghouta right now are fearful for their life because they were only willing to help the people inside Syria, inside their hometown. The challenge facing Syrian doctors are sobering. In Eastern Ghouta, there are just 107 doctors remaining to treat a population of 400,000, including more than 80,000 children. The tight siege on Ghouta had led to severe shortage of medical supplies and equipment. Medical supplies are consistently removed from the interagency convoys by Syrian security services, and essential food items have been scarce. On March 5th, as we all heard it over and over, WHO reported that 70% of the medical supplies were removed from those convoys. And those are not, we're talking about the trauma kits, but that's not the only thing that people are suffering from. People with diabetes, renal failure, heart disease, pregnant women, they don't have enough medical supply to help them and protect their lives. We are there to help them, but we don't have equipment to help them out. We must act. We must give serious consideration to the humanitarian airdrops of medical supplies, which have been carried on throughout Syria. We must consider requiring the presence of international monitors to record and accompany all future convoys in order to better protect against the removal of essential medical supplies. We cannot allow humanitarian aid to be weaponized. It is right now. There are currently, on medical evacuation, there are currently more than 1,000 patients in need of medical evacuation from Eastern Ghouta. SAMS has been sounding the alarm about the need for this evacuation since July. We met with many UN leaders and leaders of the UN Security Council since then. And back then, we were asked to submit a proposal to improve the evacuation process. We promptly did so, asking the UN OCHA to take greater role in providing oversight and accountability on the evacuation, and to take responsibility for securing the accommodation for patients and their families during their treatment in Damascus. Let me give you some numbers. The number of patients requiring evacuation at that time was 188. Only 29 were evacuated. 9 of them initially refused to leave Ghouta, knowing that they would die, but they refused to leave Ghouta fearing detention and torture in Damascus. But not only our proposal gone unanswered, the patients who were evacuated as part of prisoner swap. That's not acceptable. This is not a humanitarian operation. And on top of that, more than 27 patients have died on that list waiting to be evacuated. And our colleagues at UN OCHA know that for a fact. They have the names, they have the files. But furthermore, these patients who got evacuated to Damascus, the patients and their families, were abused and intimidated, and 3 of them died from unknown circumstances in Damascus. Medical evacuations are a purely humanitarian operation and must remain as such. Children cannot and must not be used as bargaining chips. They've been used last time. There is currently a priority list of about 100 patients in need of medical evacuation, and we should provide these patients with the medical care they need in their hometown, in Ghouta. But if the evacuation is needed and necessary, then these evacuations must be undertaken immediately, and the safety and security of these patients and families must be guaranteed by all parties. Let me just conclude by talking about the chemical weapons. Since 2012, SAMS doctors have documented almost 200 chemical attacks inside Syria, including 8 attacks since the beginning of this year. 5 of them were in Eastern Ghouta. One particularly large-scale attack occurred on Wednesday, March 7th, when a chlorine gas attack in Arria and Sakba sent at least 78 patients, half of them are children, to medical facilities. In SAMS hospitals, we treated about 29 of them. 78 patients were exposed and treated. So the victims, again, half of them are children, were left gasping for their breath and suffering from symptoms such as wheezing, hypoxia, and cough. And the videos that we received from the field are very alarming very concerning, yet there's nobody to investigate those attacks or attribute accountability. And we have done many times before. We reported these attacks over and over. We've sent the files, we have the documents, but there's no real investigation. We call on the immediate entry of inspectors from the Organization for the Prohibition of Chemical Weapons, OPCW, to investigate these attacks and hold perpetrators accountable. We are not in the business, as a humanitarian sector, we're not in the business of attributing blame. We simply want these attacks to stop. And that's a very basic right for the people of Syria, and I think we should support them and help them. In conclusion, I would like to share these words from one of my colleagues in Ghouta. Over the past couple of weeks, I have not been able to leave my hospital because of the ongoing shelling. I have not seen my kids and wife for more than 2 weeks. I cannot leave the hospital. The situation is getting worse and worse by the hour. We feel hopeless, but we will not abandon our patients. That's our commitment to the people inside Syria, and that will continue regardless we get the support from anybody or not. As I am walking to this session today, my colleagues from Ghouta asked me to request an immediate ceasefire so at least they can evacuate patients and corpses from the streets of Ghouta. The bravery and sacrifice of our staff on the ground and so many other humanitarians in Syria on all sides of the conflict should inspire us to do more to protect them. The United Nations, the UN Security Council, and international leaders must act together and come together to ensure, one, the proper implementation of ceasefire and monitoring on all sides to protect civilians, two, the delivery of essential medical and humanitarian items accompanied by the international monitoring bodies, three, and once and for all, to stop intentional and systematic targeting of aid workers and medical facilities inside Syria and hopefully across the globe. Thank you for listening.